Jessie for the advice.
Cool. So good evening, our friends and colleagues in the Southern Hemisphere, and good morning to our friends and colleagues in the Northern Hemisphere. We have a very, very international audience today. Apologies for the awkward silence and the chit-chats. I wish I had some hold music for you. I decided against Peter Andre's Mysterious Girl, so... All right, so thank you all for joining. I can see we have quite a few people in already. Just want to say a special thanks to Tracy Cammons from Vetser, and for linking VetCheck and Vetstoria. And we are honored to have Amanda Chin, the CEO and co-founder of VetCheck, and Julian Renaud, CEO and co-founder of Vetstoria. The topic today is on automations. Is very, very relevant at the moment. Our friends, we all need help, and technology is the way to go. And we'd love for you to get the most out of today's session. So the best way to do that is for you to interact with us. Use the chat function. If we don't pick it up during the talk, we'll pick it up during the Q&A. So without further ado, I'll hand it over to our fabulous panelists to introduce themselves and get started.
Thanks, Nate. Well, you introduced me anyway, so I'm just going to start. So as Nate said, it's a really casual chat tonight. If you have any questions, feel free to put them into the chat box and we'll either get to them through the presentation or else afterwards. But thank you for joining us on the webinar tonight. We're excited to share with you some automations that will help save you time and get your team more time on patient care.
Hi, everyone. Nice to be with you this evening, this morning. I'm excited to do this webinar with Amanda.
So I'm just going to cover a few slides about today's practice, and I'm sure you'll all agree that today's practice is pretty hectic. Practices are busier than ever. There's some stats that show the average growth of 4 to 20%, particularly since COVID. Teams are definitely overworked. We talk to vets and nurses all the time, and it's just really crazy at the moment. And particularly the clients, they seem to be a lot more stressed. They're more demanding, and this isn't unusual. Their pets are their family members. We're dealing with COVID and the uncertainty of that, what's happening with their jobs, with their kids' schooling. Everyone's quite stressed right now, but it just impacts the way that the practice runs. And a survey that was done actually by the Vetstoria team showed that from a receptionist point of view, the challenges are just too many calls, with 69% thinking, this is the biggest challenge that we're having now. Julian, did you want to expand anything else on this survey?
Yes, so the survey was just asking or practices. I think it was 104 practices at that time that responded. And the main challenge of receptionists, it's not a surprise, was the fact that far too many calls, they had to deal with far too many calls. It was 69%. Managing the schedule of the practice was coming second, 15%. And complaint and debt was far down the list. So that was really overwhelmingly pointing towards the direction of this phone that keeps ringing.
We also did a survey with 1,600 vet nurses, just asking them about, what's the most time-consuming part of their job? So what are they struggling with in practice? And 79% actually said it was the phone calls as well. So this really highlights with the Vetstoria survey and the VetCheck one that, there's issues with client phone calls. It's having a big burden on our vet teams. And from the client's point of view, they're being left on hold or they can't get through. So the first question tonight, which I'd love for you to put your response in the chat box, what type of calls take up the most time, do you think, in your practice? In chat, put into the chat box, just type the types of calls that you see in practice. Yeah, exactly. So Jessie, that's exactly right. So pet health questions, pet owners asking questions about their dietary and medication needs, they're unsure whether to bring pets in. So these are really detailed answers. These questions require detailed answers. And actually, you're right, they're either price shopping, they're looking for information on the prescription or a prescription refill. They're not sure what the vet had said, or they're not sure whether they need to come in. These are really detailed answers that are required to help these pet owners. So you can see how phone calls can be quite time consuming and quite a burden on our vet teams. And in fact, even just dealing with a new client, it can take over 8 minutes just to handle a new client question and setting them up. So we also did a survey asking vet nurses what's the hardest part of their job. And 68% of vet nurses said that client communication was the hardest part of the job. And this is encompassing everything. So everything from the phone calls, face-to-face, admission, discharges. Nurses find this really quite challenging. And so we can see from the phone calls, the client communication, the results from these surveys, the teams are quite overwhelmed by client communication. So I've got another question for you guys. We can chat into the chat box. What percentage of your day do you think is spent on client communication? So this is everything from face-to-face, phone, setting up SMS reminders, engaging them on social media. What percentage of your day do you think is taken up on client communication? Yeah, 90% for receptionists. Yeah, that would make sense. Anyone else?
Well, actually, I have a question for Cassandra. She said 90% of the time. Actually, face-to-face versus digital communication. So SMS, phone.
Yeah. Good question. So we've got pretty high percentages here so far, 85, 90%. So the ones that put into the messaging are really quite high. I mean, from a study that was done in the healthcare sector showed that over 60% of the time of a healthcare professional's time is spent on client communication. And this, the conclusion from this was that client communication is extremely a huge burden on our healthcare teams. But with you guys, 85 and 90%, it really is quite a burden. But the problem is that without good communication, client communication, there can be some negative consequences. So things like complaints or poor compliance or even lost business. The thing is, client communication is hard, and we've seen that from the vet nurses, receptionists, and the fact that you guys are spending 85 to 90% of your time on client communication. If we look at it from a client's point of view, this was an interesting review of 1,000 vet clinics, Yelp and Google review pages. And it was looking at the bad reviews and the reasons for why pet owners feel that they haven't got a good service from their vet. And it was everything from they found the vet was too costly, they felt the services weren't very good, that the vet or their team didn't really care about them or their pet, and there were poor health outcomes. So if you look at all these reasons, it really comes down to this misaligned expectation. And this is the #1 cause for client satisfaction. So not meeting those client expectations or meeting them from the start. So letting them know that there are potential risks, that things can go wrong, or letting them know what the potential estimates are from the start. So don't shock them with the cost of a dental afterwards. Make sure they know from the start. And also being able to be perceived as showing that you do actually care. So even though practice is really busy, the phone is taking up all your time, it's all about showing that you care and focusing on that client at that time. So the challenge is, we're dealing with busier practices, the phone's going off the hook, and client communication is difficult. But the problem is, if we don't do anything about this, and if we don't help our veterinary teams with this client communication, it can have really negative impact. And the #1 thing would be burnout. Being overworked is the #1 cause, and then dealing with clients is the #2 cause of burnout. And then complaints. If you look at the veterinary board, the #1 cause for complaints to the vet board is inadequate communication. And of course, that's a perceived inadequate communication. And then of course, lost business. So we have to remember that good communication is fundamental to every practice. It improves pet health outcomes. It forms part of informed consent and is key in delivering high quality care and best practice. And fortunately, the way we communicate with clients has evolved. And the key to this is finding that balance between the best people, the best practice, and technology. And therefore, finding that sweet spot, you have more time for patient care. So I'm going to hand over to Julian now to talk about some of these automations that we can do in practice to make life easier when it comes to client communication.
Sure. Well, thank you, Amanda. So I think that the first step is actually to be aligned on what is automation. So I'm just going to read the definition. So automation is the creation and application of technology to deliver services with minimal human intervention. Okay. So if you don't mind to go to the next slide, Amanda. So we did a survey last year, and I've mentioned it earlier, with these 104 practices, and 91% of them reported that online booking was saving them between 30 minutes to 2 hours per day. So why do you have your team really spending time on tasks that your clients can, want, and actually prefer to do themselves? No, do you mind just to go to the next one, Amanda? So back to this definition of the automation, it says like minimum human intervention. So don't get me wrong. I think human interaction are actually important. They're actually absolutely essential in a practice. Interacting with pet owners, interacting with pet owners and pet doing the consultation is what enables good patient care. So in order to have more interaction, you need to actually have less interaction where it's not needed or essential. So as an example, how much value are your receptionist team generating when they are scheduling an appointment on the phone for vaccination, while they could be interacting with a customer which is present in the clinic, in the practice, in the waiting room, or responding to an urgent call, or let's say to an upset client on the phone. So at the practice today, you have a scheduling workflow. It works today. Your receptionists are delivering this, and they do that very well. And this scheduling process should be replicated. There are emergency that needs to be triaged. There are certain vets that do certain type of appointment and don't see certain species. Your vaccination appointment at 8 o'clock in the morning, not a good idea. So all this should be automated and handled by the software. The second element is it should not really should not create additional work for your receptionist. So your receptionist team, and actually receptionists, but everybody at the practice use a PMS, a practice management software. And it means that all the appointment needs to go on this software. So no additional work really is the key. Automation is about creating less work. And the third element is it should be very easy and simple. And one of the key elements to make it easy is just to give access to what the pet owners wants to do as quickly as possible. Maybe, Amanda, you don't mind to go to the next slide? And what we do at Vetstoria is there's no login, no download, no password required, no registration. They can access the slots really literally 3-5 seconds. They choose the species. They select if they are a new client or an existing client. They choose they select the appointment type, and then the slots are displayed. Now, how they access this? Amanda, do you mind just to show an example of website? So that's a client of Vetstoria here. you have the button book online, but you also have this floating button. If you click on it, they can access the scheduling page very quickly. Automation, actually, if you don't mind staying on this page, COVID has required a specific message to be delivered to the pet owners related to safety, general guideline that receptionists had to repeat all day long during COVID time. Well, we have added this disclaimer where pet owner, in order to start scheduling an appointment, needs to read. They accept that they have read and they can move to the scheduling process. So once again, automation allows to deliver this message that had to be delivered on every single phone call, and it was taking a lot of time. Okay. Back to the slideshow, if you don't mind, Amanda. Yeah, you can go there. Yes. So another element is of automation is payment. So more and more practices are taking payment or payment pre-authorization during the booking process. I mean, this is what's happening in every other industries. People book their hairdresser appointment and they pay online, ticket of train, plane, I mean, anything. Obviously, taking payment represents a significant amount of time spent by the receptionist. So here is an example of a practice actually based in the UK. It's called Sit-down Vets. And this chart shows two types of data. You have the vertical bar that shows the number of appointments. And the light blue vertical bar represents the offline appointment, while the purple bar, the number of appointments which have been made online. And you can see that they started using Vetstoria around March 2020, basically start of the pandemic. And in about 6 months, they were booking 50% of their appointment online. So the purple one, 1,200 appointments over around 2,500. So they have achieved this in over 15% over really a period of very, very short, 4 or 5 months. Okay. Now, just go back to the previous slide, Amanda, please. Now they've also taken payment, and this is what is represented in the pink bar. This practice clearly has no intention to go back to what was before, what was normal. It's just make their life much easier and allows them to spend much more time. Actually, this practice has functioned during COVID with no receptionist at all. Everybody was booking online and paying online. So that was the pandemic reaction to emergency situation. But we have practices now. We have one practices that opened like 6 months ago, and I think it's called Stella Vet in the UK. And they've actually opened the practice with no receptionist initially. Okay, it was small. It was a new business, but that's how they have done it. Okay. Next one, please, Amanda. So now, what do pet owners think about booking online? So same survey, 47% of the pet owner extremely positive about having the option to book online, 39% positive and 13% neutral, so quite overwhelmingly positive. Now, for pet owner, what is very, very important is the convenience. It's also give them the feeling that they are more in control of their customer experience, but the clinic really is only going to allow them to do what the clinic decides. We all know, I'm a vet myself, I used to work in a practice. The start of the customer journey at the practice start by scheduling an appointment at the right time with the right vet. And that's why the customization is absolutely essential, because if you start with the wrong appointment or with the wrong vet, this is I would say, starting the customer journey on the wrong foot. So that's the automation needs to be supported by advanced customization. Back to you, Amanda.
Thanks, Julian. Any questions for Julian on saving time with online appointments? Okay, well, the next couple of slides, I'm going to go through some ways that we can automate some of these client communications to, once again, make sure that the client's getting the right information at the right time, but also save you guys time. So we can save a lot of time throughout the whole clinical process. If you think about the communications that we're having with the client and what we're saying over and over again for each single case, and depending on where they're at in the clinical process, if we think about, pre-visits, about onboarding clients, giving them information about, the COVID practices, or, fasting before a procedure, through to post-visits like discharge instructions, all about, suture care and activity restrictions. There's a lot of things in there that we say over and over again, but the problem is clients only take in about 40% of what we say, and 80% of clients don't follow through with our recommendations due to confusion. But if we can automate a lot of these things and provide it in a supporting way in terms of digital information, then the clients are going to have a lot better understanding, and you guys are going to save a lot of time in saying these things over and over again. So before I go through some of these automations, I thought I'd see from you guys, what are the things that type of information that you're giving over and over again before every procedure? What kind of things do clients need to know? And we're saying every day, in and out, for clients. If you want to type that into the chat box. Particularly for those nurses and receptionists on the webinar tonight, you guys, you would know all this stuff. So time of appointment, location, what else? Yeah, fasting times, admit procedure, important aftercare. Anything else? Well, I'll show you my list here. So exactly right. We've got things like admission time, we've got the date of the procedure, we need to go through the estimates, the fasting, potential outcomes. So from a vet's point of view, in terms of complying with informed consent, we need to explain all the risks, all the potential outcomes, whether they're positive or negative. We need to discuss alternative therapies, whether referral is available to the client, and of course the home care. There's a lot of things that we have to explain to these clients. And in a consultation setting, of 15 to 20 minutes, typically, there's a lot of information that we have to say. So what if we could automate some of these and make life easier? And I'm going to go through some of these opportunities now. So if you think about booking confirmations, these can be easily set up with the required information on a simple sheet when you're confirming the booking for the procedure. So whether it's a desexing or a dental, those regular procedures, you can set out an information sheet that has the potential general anaesthetic risks, the admission details, discharge times, home care, all that information that's required. And this is the information that typically gets us into trouble if a client hasn't heard it properly, if they haven't heard that there are potential risks and something goes wrong, or they haven't heard that a dental isn't once off for life and that they have to come back. They're the type of things that get clients angry when they're confused by information. But if we could clearly outline all this information at the time they're booking, clients are more likely to engage with this content and review it at the time, that they receive it, rather than the hecticness of a clinic or at admission time. So the way they work is you can actually set up these information sheets. You can export them as links, and you can put them into SMS reminders prior to the procedure or at the time of booking a procedure. So it's simply automating that through your practice management system and setting it up to go out, say, 2 or 3 days before the procedure. So by doing this also, you're saving a lot of time in explaining it to them, but also using it as that safety net to make sure that the client gets that information. Digital forms is another way that you can really save a lot of time. So everything from reducing that paperwork and those roadblocks at admission. So clients don't like filling out paper forms either because they're handling their pet and they're trying to complete a form. So not only is it going to save you time by converting to digital forms, but it also is a lot more convenient for pet owners. And the way these digital forms work is that they can be automated from your practice management system. They can be sent out once again, automated a few days before the procedure, and the client can relax at home, take in all the information that they need, make sure that they have all the information they need to for informed consent, and then digitally sign these forms. And when these forms are completed, they go back to the practice management system straight into the patient history for review when the client arrives. So instead of this paperwork and scanning it in and reading pet owner's handwriting, it's just opening up that file within the patient history and reviewing it with the client on the day. The other thing I want to mention about digital forms is you can actually put them onto your website as well. So this saves the reception staff a lot of time when it comes to setting up new clients. So put your new client forms, the digital ones on your website, put prescription refills, change of address, put them all on your website. So when the client calls up, it's simply, you know, we've got a form on our website, please complete that. And then everyone's alerted when the forms are completed. The client gets a copy as well as the vet practice. And in fact, we just recently finished a survey of pet owners looking at, you know, what their preferences are for digital forms. And 81% of pet owners preferred to complete digital online forms prior to their visit rather than complete paperwork or complete PDFs that had to then be printed to sign. And then another way you can automate information is the information sheets and pet health reports. So these are sheets that you know, go through all that information that's required of vets and vet nurses. So things like explaining the condition, duration of treatment, potential outcomes, alternative therapies, whether referral is an option, and the risks. So these are the things that the veterinary board requires veterinarians to make sure that the clients understand all this information so they can make an informed decision. So if you can imagine, in a 15 to 20-minute consultation, there's a lot of things and a lot of pressure that the vet has to go through this information. So it's no surprise that we have 40%, these clients not taking in this information, having to call back to the practice and clarify any of the information. But what if you could automate a lot of this information and have all these laid out on one information sheet after the pet's visit and automated to go out? So you can simply, just like you do with the booking confirmations, you can grab these secure links, you attach them to product codes, service codes, and even diagnostic codes. So when, say, for example, you've diagnosed a cruciate ligament or grade 3 dental disease, you can have this information to go straight out to the client as soon as you've charged out or confirmed a diagnosis on your practice management system. So this is, you know, really saving you guys time, but also giving you that safety net to make sure that the client does have all that information and has taken in everything that the vet has said during the consultation, as well as improve compliance and improve pet health outcomes in the end. And in fact, this study that we did also asked pet owners what would improve their experience at the vet, and the #1 feature was digital pet health summaries. They felt that this would give them an opportunity to really understand what the vet was saying, what's going on with their pet, and also give them time to digest that information when they got home, rather than in a consultation where it's quite a stressful environment for pet owners and their pets. So if you look at all these ways of automating these client communications, it does have that flow-on effect by giving the client that exceptional client experience, making sure that they're supported along every step of this clinical process, but also at the end of the day, saving you guys time so you have more time for patient care. So it's not only convenient for you and your veterinary team, but also for your clients with online appointments and forms, they're getting better information, so they're getting better outcomes for their pet's health. But it's also adding value and, you know, decreasing that client communication burden that we're seeing in practice, and hopefully reduce some of those the phone call burden. So I just thought I'd just do one slide on how we actually automate this. So I alluded to, you know, using your practice management system and setting up all these automations, and it typically takes about half an hour just to set out the top 20. So if you guys want to do that, you know, email us and we can give you that list of top 20. We also have SMS templates if you're looking for some, because, you know, SMSs are quite challenging because you typically only have around 160 characters or something that you could use within one SMS, rather than trying to put your message all through, you know, 2 or 3 SMSs. So there is an art to it. If you want some templates for that, we can help you with that as well. But essentially you find all the information. So as I said, we have the top 20 that typically can lead to complaints or clients have concerns. So for example, one is allergies, dentistry, ear infections. They're the ones that clients typically get annoyed about because it's not clear from the start that this is an ongoing problem. They're going to have to come back to the vet often. So we've set out these treatment plans that explain all the, you know, potential outcomes, the risks, the duration of treatment, all those things that help set expectations from the client from the start. And you simply grab those information sheets and you attach them to product diagnostic or service codes within your practice management system. So when all you do is you itemize that out, the information goes out to the client exactly at the right time. It's everything from product information to videos on how to clean ears or how to apply eye ointment, or say you're prescribing Meliseb for Medicaid shampoo, you can attach videos on how to actually use that shampoo, because if they don't use it properly, we're not going to get the best health outcomes. So it's all about, you know, saving you guys time, but also making sure that the client gets the right information and it's all automated. So that's pretty much how it works. And that's all we have, but we'll go through some questions if you like, because I saw a few. So the digital forms, so with VetCheck, we have all the digital forms and practice forms, and you can customize those to your practice as well. And they can integrate into any practice management system. There was a question about IDEX, and we don't have a full integration with them, but we do integrate with all practice management systems in that you have VetCheck as your forms and your digital forms and your digital booking confirmations, discharge instructions, all those home care videos, and you can just import those links into your practice management system to automate it. Any other questions?
Yeah, I can see one for me, I think.
Yeah, about a UK practice. What is the name of the UK clinic you mentioned?
Well, on the chart, it was sidelined vets. There is also a question, what's the percentage of appointment booked online versus offline, and what's the best way to increase this? So if you don't mind, Amanda, I would like to share my screen actually, just to show.
Yeah, sure.
To show, do you see my screen? Do you see the chart? Do you see it?
Yes.
Okay, so here, I'm sorry, it's a little bit small, but I just saw the question and I picked up this chart. So these clinics, is just a way to illustrate what makes a difference. And the number of appointments, what is going to, I would say, the impact on the number of appointments is only, well, mainly related to one thing, is the decision of the practice to ask the pet owner to do it. This is one clinic in the UK that was acquired by another company. During the pandemic, they were booking around 60, 70 appointments online. Then during the pandemic, they've said, look, we can't schedule online anymore. We need to have all clients calling. And then at that time, which was in September 2020, basically still during the pandemic, they were acquired. And this was also a Vetstoria user, but he was using much more heavily online booking. And in about 2 months, they went from zero, no, we can't use online booking during the pandemic, to 600 appointments online. And that's an extreme example. However, it shows really that what makes a difference is the decision, the operational decision at the practice to use online booking. Now, it's not all in a practice like this, I recognize that, but it really shows that the pet owner, they do it. We also have a large corporate using us in the US, and they have more than 500 clinics using online booking. And we see some difference of usage in between certain practices, and some significant. We have some booking 70% of their appointment online, and some are 5% or 10%. And when we ask, so what, and the really doesn't matter the locations. You can have a clinic in central New York versus a clinic in the middle of the countryside. And it's not really related to, okay, well, area such as urban. No, it's not really that. What makes the difference is the operational decision to use it. That's really the number one factor, which is going to determine the number of appointments booked. So that's the response to the question. So how to increase it? Communicate to your client. Your receptionist needs to be comfortable with the concept. When client comes, mentioning it, that's extremely powerful. Then obviously you have, an integration on the website, which should be good, but that makes sense. But having your team mentioning it and being comfortable with online booking is the number one factor, which is going to determine the performance.
Thanks, Julian. We also had a question about do we integrate with RxWorks? So I'll answer from VetCheck's point of view, which is the client communication tools and forms. We have a full integration with RxWorks, which means that everything you share goes straight into the patient history as part of their pet record. All the forms that are shared out, when they're complete, they go straight into the patient history. You get alerts. There's automatic reminders when the client hasn't completed the form. So some of the forms are pre-filled. We have digital vaccination certificate and health certificate. So yeah, we've got a really good integration with RxWorks. And do we work in the UK? Oh, well, sorry, I'll let Julian answer that question. Do you integrate with RxWorks?
Sorry, I'm on mute. Absolutely, RxWorks was actually our first integration. So yeah, absolutely, yes. And
then the question about do we work in the UK? Yes, we're a global software company. We have clinics all around the world. Julian, you are a UK company. I'll let you answer.
Despite my very bad French accent, we are indeed a British company, yes. And I can see also, so there's a question of, can you also discuss the ability not to allow vaccine or preventive health appointment to be made within 24 hours? So yes, Tracy, I can see that you had the request of the question quite a lot, so that's why you're raising the topic. So obviously, practices have been more and more busy, and certain type of appointment are less urgent. So we have more and more practice which are adjusting the availability online based on the type of appointment. For example, you could have first vaccination available in 5 days, 7 days, and a sick appointment you can book within the next 24 hours. So Tracy, good question. Yes, per appointment type, this availability can be adjusted.
There's also another question about whether the digital forms can be automatically saved into patient history. So with a full integration, absolutely, as soon as it's sent out, the copy goes to the practice management system and the patient history. As soon as it's completed, it's there as well. So everything's in real time. Pre-filled next time, I'm not sure what that means, but there is a pre-filling ability within the practice management system with the full integrations. We do not have, there's a question about Merlin. We don't have a full integration with Merlin, but it just means that you will have a history of everything that's shared, everything's still real time, but you need to grab it from the browser. And it still forms part of your patient record that will remain live for the legal requirement. And it's simply just cutting and pasting those forms into the patient history. Yep, with a partial integration, you do get an alert by email. So what happens is when the form is completed, the practice will get an alert to say that, you know, John Smith has completed the form, and then you open the link and it has all the details in it. So at that time, you can cut and paste that link and put into your patient history. Otherwise, and at the same time, the client gets a copy as well of those digital forms. So that's what happens with a partial integration. Any other question? Oh, is the question about what about Telios? I'm not sure what Telios is, or Telios.
Maybe asking you if you are integrated with Telios. I mean,
is that a practice? Is that a practice management system?
That's correct.
I'm sorry, I'm not familiar with Telios. So once again, that would be a partial integration, not a full integration for us. And well, Vetstoria, you're integrated with it.
Okay. That's already a lot of questions.
Yeah. Any other questions? Well, I'll just share our screen as our, you know, special promotion to thank you for being part of this webinar. Feel free to contact us after the webinar anyway if you have any questions, like if you're looking for some, you know, SMS templates or how to connect these with your practice management system. We're happy to walk you through that and show you how to hook them all up. So as a special promotion from VetCheck and Vetstoria, we're offering the first month free if you sign up before the 15th of May. And there's also details here on how to book a demo. So our demos are typically 15 minutes and they run you through the process of setting up your client communication library. You get over 2,000 communications ranging from everything from home care videos to discharge instructions in the forms. And then, and we just walk you through on how to then integrate it and save your team time. And then Julianne, with your demo, do you want to share how that works?
So very simple. You go on your website, you click demo, you put your name, you can pick up a time, and you will speak to, well, you will have a one-to-one session with one of our team members, and they will do a one-to-one session with you, and we'll go through the system and respond all the questions you might have.
So I just saw another question from David, good question about, you know, what do you do once you go digitally with consent forms on that? Because a lot of practices have in the past printed out these consent forms, signed them and put them up on the cage. Those clinics that have gone completely digital don't do that anymore. A lot of them use these kind of cage cards. Not sure if you can see them, but they're like laminated cage cards that you can just, you know, check off whether on the consent form they've asked for, you know, specialized pain relief, pre-anesthetic bloods, you know, vaccination, and they're just put on the card. And then if you need to access the consent form in any way, you just go straight to your practice management system and open up the link, and it has all the information in there. But those clinics have fully gone digital and paperless. They don't print out the forms or anything anymore. It's just laminated cage cards. Okay. Well, thank you very much for joining us tonight. I hope you've got some good tips on how to save your team time and make life easier, reduce client confusion and, continue to grow your businesses, but, not have to have extra burdens. And we appreciate your time.
And spend more time with your patient than the clinic.
Yeah, absolutely.